So one of the most important things that I think you should learn in life is how to perform CPR, because if your best friend has a heart attack after a football game, you need to be there for him and know what to do. So first thing, when you arrive on the scene is either, if you're by yourself, you want to call 911 because you want to get an AED to the scene as fast as you can. Or if there's someone near you, tell them to call 911 so you can get started on checking the person's vitals. So when you go to check their vitals, you want to take 2 or 3 fingers, just depending on how large the adult is. You want to put it on their forehead and just gently lean back their head so it opens up their airway. And then you want to take 2 fingers and you want to put it right on the side of their neck, about right here, and feel for a heartbeat. And you want to put your head down and you want to look for the chest rising, and also listen, because you might hear some wheezing from them if they've got something stuck and it made them black out. So if they were choking and they did black out, and you establish that because they aren't breathing, but you can see a heartbeat or feel a heartbeat, you want to take your 2 fingers and you just open up their mouth and you dig for it and try and just pull it out yourself. If you can't feel anything, but you can still tell that they're choking because you can hear just little bits of air coming out, you want to start doing some chest compressions just so that the air from their own lungs might push out the substance that is caught. If they had a heart attack, heart stopped, you want to start in on your compressions. So when you want to start on the compressions, you want to take the palm of your hand and put it right in the sternum, right here. And you want to cross your other hand over top of it. And then you'll just get over top of them, and with quite a bit of force, you'll push down on them. Mayo Clinic, American Heart Association, and the Red Cross say that you want to go 1 to 1.5 inches down on the chest when you're pressing on them. So you will do 30 chest compressions right here, and then you'll do 2 breaths into their mouth. When you go to give the breaths, you want to make sure that you pinch the nose so no air can escape through their nose. And you want to get your lips around their mouth so that you're blowing all of your air from your lungs into theirs. And you want to do 2 of them. So you go down, take 1 breath, come up, take a deep breath again, and then blow the second one into them as well. And then you would go back to doing your chest compressions 30 again. And do this for 5 to 6 times according to the American Heart Association before checking their vitals again. You may accidentally break a few ribs while you're doing the chest compressions, pushing down, but the Red Cross says that it's better for you to break a couple ribs and restart their heart than for you to be going too lightly and the heart doesn't start again. If you have a partner or someone near you that called 911 for you, they could do the breaths while you do the chest compressions, and after 3 to 4 rotations through, you'd want to switch with them because it does get very tiring, and you can be very tired and the ambulance isn't there yet and can't have an AED and professionals there to help you. So once you've done that, and if you do go down to check their vitals again and you can feel their heart beating, you don't want to do any more compressions. They might start breathing just barely, and you can hear them just wheezing. In that case, you might want to sit them up and then sit them back down because their airway might be constricted. Once the ambulance arrives, they may use an AED to restart the heart as well, and you may save the person's life. Us at Spencer High School, we know what it's like for a homecoming king to have had a heart attack after a football game, and luckily we had 2 teachers there that knew what they were doing, and that's why CPR is one of the most important lessons you can learn in your life, because it can save someone's life and you never know when.